Director of the Department of Alcohol and Other Drug Abuse Services. I'm here this morning to give a brief introduction to the issue of behavioral health as it affects folks in our state and across the nation. Behavioral health is a larger term for, in my mind, two very important chronic diseases, substance use disorder, the one with which I work every day, and various mental illnesses such as depression, schizophrenia, or other serious mental illnesses. So the critical thing I'd like for everybody to understand is that behavioral health, mental health, and substance use are part of a larger whole. The individual does not exist in two spheres, a mind and a body. The individual's health is a function of both of these and the way they interact. In our state and across the nation, we tend and have for really centuries, certainly for the past 100 years, we've separated the treatment for these diseases. Part of that separation comes from a sense of stigma or a sense of mental illness or alcoholism or drug addiction. Our diseases seem to be the result of a lack of willpower or some moral failure. That is totally inappropriate way to approach this issue. And I think one of the real problems we face and one of the things we work on every day is to try to integrate behavioral health and physical health. As we do that, we find and we are able to address issues for the folks with mental health issues or substance use disorder issues have much worse physical health status and physical health outcomes. Folks with poor physical health, as they get sicker and sicker, depending on the nature of the chronic disease, tend to have co-occurring mental health issues or substance use issues, either as a direct result of their treatment regimen, that is, would say, for example, prescription drugs, or as a individual coping mechanism to cope with their physical ailment. They then eventually develop behavioral health issues. These are not separable spheres in the health of an individual. The critical issue for us to remember is that health of an individual severely and significantly impacts the health of the family and the health of the community in which they reside. So as we go about our work in helping folks with their behavioral health issues, we perforce deal with not only the individual issue and his or her physical problems, but we also deal with the health of the family and the health of the community. If we do not address the health of the family, then we have not done our job. I would like to also point out, as we go down this road, I want to reiterate that this is a chronic disease. These are chronic diseases. Like other chronic diseases, diabetes and COPD, there is a treatment regimen that can be effective, and there is a recovery. This recovery period is very important to me. I personally am a person in long-term recovery and been some 29 years since I've had a drink or an illegal drug, and I am very committed, as are all the folks that work in both the Department of Alcohol and Drug Abuse and in the Department of Mental Health, to supporting individuals in their recovery. Individuals in recovery are part of the solution because each of us, one of the tenets and one of the strategies of our own recovery is to help others, so that we will meet in mutual agreement with other folks who are currently suffering this and lend help and support. This capacity of the recovering community to influence and assist in the treatment and recovery of those individuals who suffer from mental illness or substance use disorder is, in my mind, one of the more beautiful opportunities faced by someone who has this disease. Not only can we recover, we can help others on the path to recovery. So why is this important? Generally speaking, in the world of mental health, folks with a severe and persistent mental illness diagnosis live 25 years less. Their life expectancy is 25 years less than those who do not have that diagnosis. The numbers are similar for folks with substance use disorder. I encourage each of you to find a place in your career and in your study to deal with either prevention, intervention, the treatment, or recovery support for the issues involved with behavioral health. Thank you, and I hope you enjoy your day.